So when I first joined VA, I was in VHA, which is the largest department under VA, which is the healthcare branch. It has about 360,000 employees, and they care for 9 million active lives, and overall they have about 21 million veterans that they care for at any given time. So really, large group of people, large scope. They have not only a provider but also payer. And I was responsible for the operations and running of this group called the Deputy Undersecretary's Office for Healthcare Policy and Programs. And basically what that was is all of the research departments, the R&D, informatics, connected care like telehealth.
So you're the tech person?
No. So I ran also all the programs, primary care and specialty care programs that was run out of all of the VAs. So the 178 medical centers plus the thousands of clinical facilities, the clinical programs that were administered there came under our purview. We didn't actually manage the facilities, but we ran cardiology and setting the standards and setting policy and thinking through how it would be delivered and standardized across the VA, across all of those specialties and primary care programs.
You've told me a little bit about your Ditch the Disc project, and I wanted you to share that with everyone because I just think it's so classic of the healthcare system that you mentioned you had a special computer at home that actually takes CD-ROMs and has a disk drive.
Yes.
Because in healthcare, we still share CD-ROMs. Like, it's so insane, and faxes and pages is still a thing.
I do have a fax, and I have a computer that has a CD at home. And I'm a radiologist, for those of you that don't know, and I still get, and I do practice, not as often as I did before, but I do get people's CDs for second opinions, and a lot of times it comes with its own viewer, and sometimes it works and sometimes it doesn't. And so the whole reason I started the whole ditch, so I in my as a volunteer project in my free time, I work for the American College of Radiology, and I lead this initiative called Ditch the Disc. Kind of how Axe the Fax came about. And I started this earlier last year because my mom years ago was diagnosed with ovarian cancer and would go around from treatment to treatment. Not only would she carry around bags of her printed out sheets of paper from her EMR, she also had all of these CDs that she carried around, and I had a Sony Vaio that I purchased. It had a CD drive, because a lot of times you'd go to hospitals. Apple Computer, I think they got rid of CDs, 8 years ago now? I don't know, I can't even remember.
I don't know where we'd find a computer that would take a CD-ROM.
Yeah, it's so disrespectful to people that you're going to make people go to hospitals and have them wait in line to get your CDs and take it to another hospital. And neither you can look at it nor the doctor, you're waiting around outside. Hopefully you're going to bring a good book or something to read out there, because trust me, in the back, I'm hoping that this viewer that they put on there is actually going to work with my system, and I can get this put into my PACS system. It's just outrageous. And we're talking about interoperability. It's been only about 10 or 20 years we've been talking about interoperability. I don't hear anybody talking about imaging interoperability, and it's really important when people are sick. They're carrying around their CDs for cancer care. They're carrying it around for other types of chronic illnesses. And it's not just DICOM imaging, right? It's beyond that. You've got pathology reports that have to go out, pathology images. You've got cardiologists that are doing angiograms, and they have stuff they have to send out. So it's neurosurgeons that are doing things. So you've got all these specialties and people who are sick that have data beyond what's in your EMR that's going out there, and we're expecting people to carry this around, to be transporters. And I'm like, is this really what we should be doing to our patients who are sick? Personally for me, I want a patient-mediated form. People say, well, why should patients have CDs, or why should patients have their images? Well, you know what? Maybe I just want to post it on my Facebook. Maybe I want to go to a different doctor, right?
Yeah, maybe I want to walk it across town and give it to the next physician, which I've had to do.
Yeah.
Then it scratches up in your bag.
Yeah. And so we should have an easier way for patients to be able to transfer things.